Okay, class, we're back with part 2 of our video explaining the difference in mental health education, licensure, and jobs. So we were just talking about social work and about how at a master's level you can get a job doing counseling, some testing and some not testing, and case management and many other things. There's also another degree that's newer, as in the last 20, 30 years, called marriage and family therapy. They can do counseling also in many states. Obviously, by the name, you can tell that the training itself is less general than, say, social work, and more focused on counseling specifically with family and couples. However, most of them do some individual therapy also and are licensed to do so in a lot of the different states. So let's just touch on this real quick. If you want to do counseling, you can do any of these degrees and be able to do it at a master's level usually or higher. So what's the difference in training then? Why do this more? So LPCs, licensed professional counselors, they get a lot of counseling training. That's all they get trained in. They do a lot less, little to no in testing, and a ton less in research than a PhD or PsyD level psychology degree. So if you want straight training for just counseling, that is the place to go. Where master's level social workers, or LCSWs, after you are licensed, they get a more general training. They can do a lot of different jobs along with counseling, including case management, working in hospitals, working in a lot of different areas, prisons, anything where you hear about social workers being talked about. Sometimes they're bachelor's levels, and sometimes they're master level social workers. So, their training is more general, where this training is more specialized in counseling, and this one is more in marriage and family therapists. But in the end, they can all do counseling. And generally, if your whole idea is just to hang a shingle, they can all do that too, depending on the state. So that's the biggest thing here, is that if you want to do counseling, you don't have to get a PhD all of the time. There are a lot of different options to do that. So let's talk about some of these other things. So of course, you can also do counseling if you are a doctor that went to medical school, a nurse practitioner, or a physician's assistant, these latter two specializing in psychiatric illness or mental health, sometimes called psychiatric nurse practitioners or psychiatric PAs. Any of those can do counseling. Now, will you? Probably not, because it makes a lot more money typically to prescribe medications, which is the point of those degrees. Obviously, to get an MD and become a psychiatrist, you have to go to medical school and then do a residency in psychiatry, and then other certifications may be necessary, so it's a lot longer road. But if your point is to make the most money, obviously going to medical school for psychiatry or something else is going to do that. However, for a lot of people who want to prescribe medications but don't want to go to medical school, being a nurse practitioner or a physician's assistant is a way to go. You can work a lot of different settings, outpatient, inpatient, hospitals, private, government, you name it. And you still get to prescribe medications. And to be honest, in the future, most psychiatric medications that aren't prescribed by your normal general doc, to see a psychiatrist, you're going to be seeing an NP and a PA, because the amount of MDs that are being used tend to go to other areas. MDs and even DOs, which is another form of medical school that you can go to. But most of them end up going to, serve in other specialties or are just less. And so NP and PAs are going to prescribe the majority of serving, quote unquote, as, psychiatric medication prescribers. But even in general, your general docs, your family docs, prescribe the majority of psychiatric medications in this country. So if your idea is just with medications, here are your options. And guess what? In some states, literally 3 of them right now, New Mexico and Louisiana, and I believe Illinois just passed it, could be wrong there, PhDs in psychology can get certified to prescribe medications. It's an additional couple years after you finish your PhD. The military also uses them in some respects to prescribe medications in some settings, but it is additional training. But then they can do both. They can do all the above. So that's the biggest thing here. First, you got to look at, what do you want to do? And then which degrees will give you the most security and access to do those. This is the biggest one I bring up, and the whole reason I even do this lecture is because if you just want to be a counselor, you have no interest in any of this stuff, there are lots of options. You don't have to kill yourself getting a PhD. You don't have to, if that's all you want to do. Will you make more money doing it? Maybe, but maybe not. I know some people who have master's degrees who make a lot of money, who have good clientele, or have a good job that does that. So then what, again, is the point? The point here is do what fits you. And do a lot of research in this class and before you finish your degree on how to do that. So, for example, I myself knew I wanted to do counseling. Thought maybe I want to do some testing, but I wasn't quite sure. Thought it'd be cool. And I knew that I didn't want to do this long term. Then when I finished, I wanted to be in counseling. That is what I wanted to do when I was an undergrad at BYU, Idaho, a few years ago. So I looked in and I applied to PhD programs, and I applied to PsyD programs, and I applied to Masters in Counseling programs, and even a Masters in Social Work programs to cover all my bases. But I knew that if I could, I wanted to do a PhD. Now, why did I want to do this? The same reason a lot of people want to do PhDs. I knew I wanted to be able to do what I was doing with you now, at least on the side, which is teach. Now, you can teach with a master's degree, as many of your online professors are here, but then generally I wanted that to be an option. But then the other thing I knew is that if I could get into a PhD, it would be less money. Generally, PsyDs cost more money than PhDs. That's not always the case, but generally that's the way it is. A lot of PhDs, not all of them, but a lot of PhDs in clinical or counseling psychology, remember there's two paths we'll talk about in a second, two different PhDs in there, a lot of them have some kind of financial assistance if you do the PhD, specifically because you're doing research at the same time, so you have grant money that can pay for part of it. So, for example, I got financial assistance in my first year of grad school. And then as I was earning my clinical hours, I also got money to do my clinical hours, to work at all these different places to get the hours that I needed to become a counselor like I wanted to and to be certified in testing. I had to get those hours anyway, but I was able to finagle and work with the program to do ones that paid money, which helped reduce my costs. I have some friends who did PhDs that did so much research, worked on so much grants, that their entire school, at least their tuition, was waived every semester. And a lot of other things, they got some stipend even, is what it's called, and were able to get some financial help. So why do a PsyD? PsyDs generally are easier to get into, and they are very clinically focused. There are some PsyDs who do go into research and teaching primarily, but most schools are geared, they're called professional schools, much like dental school or podiatry school, where you're not getting an MD, but you want to be able to do a profession in an area. And so podiatrists have podiatry school, dentists have dental school, and they all have their MD counterparts that aren't them, but they do a professional school, and PsyD is the answer to that. So generally it's very clinically focused. You have to do some research, but it's not the focus of that. But as all professional schools are, they tend to cost more money. So the debt may be higher. Now it just depends on which ones you go to. The other thing you have to be careful about is class size. Generally, PsyDs have bigger class sizes. For example, my PhD clinical program started with 10 students is all, where PsyD programs, some of them start with 10 students, but I've heard of some that have up to 75 students in the same class. And so that can be a very big difference in your training, especially when you're trying to find clinical hours and you're competing against your own fellow students. So just do your research. With any of these things, just do your research. And don't be afraid to apply more than one. You don't have to commit until you go. Just figure out what you want to do. So if this is the job you want to do, or any of these are the jobs you want to do, I hope this was helpful in figuring it out. Now, please, please, please contact me. I want to be able to help you out in being able to figure out what you want to look into. Am I going to be able to give you your life answers? No. But I hope that I can impart some of my wisdom and send you to some people around campus to let you know which one of these many degrees would fit you in your quest to become a mental health worker of some time. Now, one last thing. If you know, for whatever reason, you want to get married and have a baby, you just don't want to do more school, any of those things, if you want to just get a bachelor's degree and stay in mental health, look at a degree in social work, because you can get licensed at a bachelor's level. And in many states, you can get a job that people without that license can get. Because that's what a license does, is it gives you a pass saying you met qualifications so you can get a job in that field. So look at that if you really just want to stick at a bachelor's level. But then again, don't be afraid of graduate school. You know, a lot of people, they say, you know, is graduate school harder classes? Was that what it was? No. It wasn't harder classes. It was just more work. You're doing practicing counseling. You're doing research. You're taking classes. You're learning how to do testing. You're doing it all at the same time. So most of you, if you can get through a bachelor's degree, you can get through a graduate degree, and you can figure it out. And there are many different options to do that. So if anybody has any questions, feel free to give me a ring. I hope this is helpful. Hey, give me some feedback in the discussion board if it was helpful, so I know whether to post this again next semester. Thanks.